Hello friends, Dr. Sangeeta back with you for another lecture of Dental Pathshala where we help you understand and learn dentistry better and easy way. And today's video, we are going to talk about the House classification, which is the patient's mental attitude classification. So House, Dr. Milus House divided the patient attitude in 4 personalities. So it can be hysterical, exacting, indifferent or the philosophical attitude. So without further ado, let's get started. And before we get started with the House classification given by Dr. Milus House in 1915, make sure you subscribe to our channel and click on the bell icon so that you don't miss any of our future interesting videos. And today's video, we are going to talk about the House classification, which is a frequently asked question for students, for Viva, for case history. Now, what is this House classification about? It is basically a classification of the attitude, mental attitude, of the behavior, you can say, of the patient. So how a patient behavior, it actually depends on the prognosis of the treatment. So how the treatment should be provided, it is based on the attitude of the patient. So according to House, Dr. House, he classified the patient's mental attitude in 4 possible groups. So the first one is the philosophical patients. Philosophical patient is actually the ideal patient, or you can say it is the best mental attitude of a patient. Now this patient is usually agreed for the treatment procedures. So for example, if we ask the patient to come for 4 to 5 appointments in order to deliver a complete denture, the patient agrees to it, and in fact the patient is willing to go for our advice, to go for the dentist advice, and he agrees for the treatment, he agrees for the diagnosis, he agrees for the follow-up. So this attitude, the philosophical attitude patient, usually come up for follow-up, and whenever we call the patient come on time, the patient agrees for the treatment, and when required, when we advise the patient for the denture replacement also, they agrees for it. So basically this is the ideal attitude of a patient. This kind of patient are usually, their personality is more like a motivational personality. You know, they feel like that teeth should be replaced. They feel like that, yes, we want teeth now. For so long, for whole of our lives, we have not eaten anything good. So these kind of people, they agrees for, they accept the dentist treatment. Next one we have is the exacting. As the name suggests, that means these kind of patient will do the Google search and they'll come to you and tell you about the treatment. They will tell you that this is how the treatment should be done. So these are a kind of patient who are kind of exact, who tell you that this is the exact kind of treatment which I want. They will come and tell you that this is the kind of teeth I want. I want big teeth. See, the size, the shape, the length of the teeth actually depend on your oral situations, right? So the teeth setting, kind of teeth which we are doing in the teeth arrangement, it depend on the oral care conditions of the patient, it depend on the arch of the patient and so many factors. But the exacting kind of patient, they will come to you and they will tell you about what the treatment should be done. They will command you. So these kind of patient, they are very exacting, they have lot of demands. So these are the patient who actually doubt some kind of somewhere the ability of a dentist, and they doubt that the dentist is going to make a good aesthetic out of the treatment, out of the denture. So they will tell you, they will command you about the aesthetic and the functional requirement. But these kind of people are usually people, you know, who are not paying extra to the dentist, but instead they want that guarantee. So these are a kind of patient who will ask for the guarantee always, that you have to guarantee this, you have to guarantee that. But once these patients are satisfied, once you have come up with their expectations, they are our greatest supporters. So they will bring you so many patient more if you satisfy these kind of patient. This is the exacting patient. Next one is the hysterical patient. If you have seen any patient, you know, who always keep on complaining, who are not ready to accept that the problems can be within, but instead of that, they blame the dentist, they blame on others, they have some kind of unrealistic expectations. So they will expect that the denture or the prosthesis should look like the natural teeth. So these are the hysterical type of patient, these are emotionally unstable patient. So that is why we tell that hysterical patient. These people, they have very much of negative attitude toward the treatment. They will not maintain a good oral hygiene, so they will have a poor health. Always they will keep on complaining, so they always have complaints ready. And in fact, these people, they have failed with their previous dentures. So with the past attempts of their denture, they have failed in that. So then the major reason is that they have got unrealistic expectations. We cannot fulfill their expectation no matter whatever you do. They expect that the teeth should look like the natural teeth which they had. And even if you make a good attempt to do it, they will not get satisfied. Something or the other, they'll keep on complaining. So this is the hysterical kind of patient who are emotionally unstable, who are always excitable patients, who are excessively apprehensive patient. Talking about the last attitude, which is the indifferent patient. Now these indifferent, as the name suggests, they are kind of a indifferent. So they are kind of a different attitude. They won't pay you attention. So they are least bothered. It's like that some of the family member have insisted to get a denture done, so that is the reason that they are coming. They are just sitting on the dental chair. Whatever you do, they are least bothered. So these are a kind of indifferent patient, and these kind of patient in fact have got a questionable prognosis, because even if you make a denture, you don't know that these people are going to wear it or not. And in fact, whenever you are giving instructions also, these people, they will not pay attention to any of the instructions. They will not be even cooperative. So these people are usually found with also poor dental health. So these are the 4 attitudes of the House. So this is the patient's mental attitude which was classified by the Dr. Milus House. And if you want to remember this, you can remember I have a mnemonic, like always. I am ready with the mnemonic. So the mnemonic is, you can remember it, exact philosophy with different history. So exact philosophy with different history. With different history. So you can remember, exact is the exacting patient, philosophy is the philosophical patient, different is the indifferent patient, and history you can remember from the hysterical patient. So you can remember exact philosophy with different history is the mnemonic for House classification, wherein the patient has got 4 kind of attitude, mental attitude, but there is a revised classification. So because the House, he didn't provide much information about the patient reaction. He didn't provide us information that how the patient reacts or how the patient behaves with the dentist and towards any treatment. So that is the reason that we have a new classification, a revised classification for House classification, which is usually the ideal, submitter, reluctant, indifferent and resistant, which we are going to talk about in some other video. So I hope that you guys have enjoyed the House classification, which is the philosophical attitude, exacting, hysterical and indifferent attitude. I hope that when you are taking a case history, you know that whenever you are talking to a patient, whenever you are asking the expectations for the treatment, whenever you are asking for the past dental history, you can make out with the patient's attitude. And when you are doing the treatment also, you know that the patient's attitude while you are talking, interacting, communicating with the patient, you can understand it well, and depending on that, the patient will have the same prognosis. Hope that you have enjoyed the video. If you have enjoyed the video, give it a thumbs up. Also, you can comment in the comment section below. There is a link in the description box below to support me on Paytm as well as on PayPal to make free videos for you guys and to make free notes. So till then, keep reading, keep learning, stay motivated. I'll see you soon in the next video.